We're having this hearing. I think it's very important. I think the American people want to understand why their healthcare costs are sky high. Sadly, I think, and I'll say this, I think their healthcare costs are sky high because of this place. This place regulates the hell out of the healthcare industry to the point where there is no choice, right? We talked about the driving costs is that we have consolidation. Well, normally, if people are making obscene profits in any marketplace, that would be a great opportunity for a new entrant. But we have regulated the healthcare industry to such an extent that no one can enter into the market to compete and provide more choices. Now, the one thing that I have seen, because I served on a board at Missouri Consolidated, where it was my responsibility as the board to buy the health insurance for over 100,000 lives. And you know what? When we did, we found that using a PBM dramatically drove down our costs for the entire group, okay? So I've heard testimony here that it's a false choice, but I can tell you when you're actually writing the checks, it's not a false choice. It did save money. And so it's good to hear that there are choices. So Mr. Baker, I'm gonna ask you, your PBM model works differently. Can you describe that?
I think it's functionally three different things. One, we do think profits are a problem in driving bad decision-making in healthcare, so we are not a for-profit entity like a C Corp or a public benefit.
Do you believe profits are evil or something?
I think if everybody knows what you're paying for an item and the American consumer can make a decision on that profitability that they're contributing to, that's fine. But that does not exist in the pharmacy benefit space.
So, okay, we can have a long conversation about that. But my question at the end of the day is, when a company like Missouri Consolidated or other businesses are choosing a PBM, at the end of the day, they just want to know what you cost and what they're getting back from it. So why are you, to me, the question is, if American Airlines were here and they were, had one rate and their mileage system is different than United, which it is, can you imagine a scenario where American would have the temerity to come to Congress and say, our mileage system is better and more transparent, therefore all the other airlines should have to move to our business model? Can you imagine that?
I don't imagine that, but in the pharmacy space, it is fundamentally different. I know if I want to buy a flight to come here to Washington, D.C., I can look at American's site, I can look at United's site, and I can make a decision on cost.
I beg to differ. At the end of the day, Mr. Baker, you're competing with other PBMs, correct?
Correct.
And the businesses who are making these choices, they're deciding based on quality and costs, correct?
I don't always agree with that.
And so to me, it's regulatory capture to come to Congress and advocate that your competitors participate or run their businesses the exact same way. So with that, Mr. Scott, let me ask this. We've talked about the consolidation. What kind of things could be done? I'm intrigued by the idea that you had that to let pharmacies do more. Can you elaborate on that?
Yeah, thank you for the question. So think back to all of our collective experience during COVID, where we had to go to get our testing, where we had to go to get our vaccinations. The rules were eased to allow us to use the pharmacy as a site of care. There are so many things that a licensed pharmacist should be able to do, in particular in rural counties where your doctor's office, your hospital may not be close. Administering vaccines, administering shots, checking your blood pressure, some of those routine healthcare screenings where they can add value by interacting with the patient instead of simply the revenue model being primarily the pill in the bottle, which remains critically important, but we think there's so much more they could do, which adds revenue for them and value for the system.
And my time's getting close, but it appears to me that just the common theme is that centralization causes skyrocketing costs. In my opinion, decentralization could be the answer, but with that, we have to trust mid-level providers to do more. We have to trust pharmacists to be able to administer some of the healthcare that patients need. And then my last question, Ms. Tripoli, has to do with transparency. If I'm going to go shop for where I'm going to have dinner tonight, I can see on Yelp amazing information, costs, the value, the ratings of different restaurants. Why can't we get to that point in healthcare?
Part of the reason is because of the way that prices are negotiated, and the way they're set is in closed-door negotiations between plans and providers that price, the negotiated rate, is buried in a proprietary contract, never to be seen by the public. Now, with these regulations, transparency and coverage and hospital price transparency, we're seeing for the first time what the actual underlying price of a healthcare service is. So now we can actually get the data and look at it, pull it down, and understand where are prices needlessly high, where are they competitive, and then we can make more informed policy decisions.
Thank you. Sadly, my time has expired.
Thank you.